Thank you very much. Good afternoon. BreatheWell is a medical device that improves the delivery of cancer therapy, reducing medical complications and improving patient quality of life. These 6 cancers, abdominothoracic cancers, are responsible for 12% of all deaths in Australia. And worryingly, this statistic scales actually proportionally worldwide in all developed healthcare systems. They're major killers. Over 50% of patients will be treated using radiation therapy, which is a precise delivery of radiation to the affected tumour cells. But these treatments are exceptionally movement sensitive, and a patient needs to keep still for 30 minutes during each procedure, over 30 subsequent procedures, which is fine if you've got a bone cancer in your leg and you need to keep still. But if you are a lung cancer patient or a breast cancer patient, the only way that you can keep still is if you hold your breath. Most of these patients, such as Mary, who is a breast cancer patient, are quite sick, and they can only hold their breath for 10 to 15 seconds at a time. And so these patients, including Mary, need to be guided into the correct position so that the radiation is delivered effectively to the tumour, but not to any peripheral healthy tissues, because if we deliver radiation to the heart, it could be potentially fatal over the longer term. And so if we look at a cross-section of Mary and her treatment, firstly what we can see here is that the doctors have tried to position the beam obliquely off to the side so that they do their best to miss these tissues. But if we see Mary, when she exhales, her heart is compressed up against the chest wall, and often it's unavoidable that the heart enters the radiation beam. When Mary holds her breath, though, her lungs expand, her chest moves forward, her breast tissue also moves forward, and the heart moves out of the way, and the doctors have a clear shot. So what we try and do for patients, including Mary, is guide them into a position, but in today's cancer therapy, we typically use verbal commands to do that. And the clinicians, obviously trying to avoid radiation exposure themselves, do it from another room across the hall. And so it's very tricky to reliably guide Mary into the correct position to always consistently give her a clear shot of radiation to treat her tumour. And so we have developed BreatheWell, which is an audiovisual biofeedback device that places the feedback to the patient reliably in the room in real time. So what we have is a sensor array that scans the patient's chest and delivers, I suppose, or develops a 3D point cloud, analysing the chest space and volume of the patient. It's computed in real time, 30 frames a second, and then that information is actually displayed right back to the patient in the form of a screen with a visual guide, so that every time Mary takes a breath, she can be ensured that she's in the best position possible for a clear shot of radiation therapy. And so this technology is not brand new. We're quite a way down the commercialization process. It's brand new to the market, but we've been performing clinical trials over the last 24 months, successfully in 10 hospitals worldwide with 85 patients. We've now used that information to develop a prototype that's in its final stage and is getting ready for market development or market entry early next year. And we'll use that final stage pre-sales product to secure regulatory approval mid-2016. So we're very close to market. The data has been very promising, and so this year we secured $400,000 in investment capital from Sydney Angels and Sydney Seed Fund. We also have the NH&MRC federal medical funding also assisting us with the development through the University of Sydney and our clinical trials partners, which are 6 world-leading New South Wales hospitals. The market in itself is compelling. There's always a business case. The market in terms of unit sales is a $2.5 billion market to us if we were able to pair one of these machines with every clinic or treatment suite, which is certainly compelling from an investment point of view. And our team, especially the clinical team, is world-class. Professor Paul Keel is one of the top medical radiophysicists in the world. And myself and Ben Wright are on the business side, coordinating the technology entry into the market. And we have a world-class academic team of Sean, Ricky, Kuldeep, and Robin. And so here we are today. We're asking for your help. Obviously, a $15,000 prize or a major prize would be great for us. We could deliver another prototype to another hospital. but we are getting ready to enter the market. And so we're looking for clinical partners. If you're a big company, a Siemens, a GE, a Varian, or an Elekta, we'd love to talk to you. And we're also looking for collaboration and potentially even governmental support. Thank you very much.
Thank you, Daniel.